Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Signs, symptoms and uses of Homo-Remedy Ruta. Full name Ruta Graveolens. Common name Rue. Source plant vegetable kingdom. Therapeutics. Eye affections, chest affections, bone diseases, uterine diseases, facial paralysis, sciatica, rheumatism, hearts and injury, constipation, enuresis, etc. etc. Spheres of action: bones, joints, eyes, urinary bladder, uterus, skin, and so on. Relation with heat and cold: chilly patient. Miasm, soda and psychosis in the backdrop. Generalities of Ruta: physical and mental. Scrofulous exostosis and warts on the palm. Scrofulous means, scrofula is tubercular congenital inheritance of tubercular characteristic is scrofulous. Exostosis is bony swelling. Warts on the palm. Has special affinities for fibrous tissue. Has mane this medicine has. Flexor tendons, joints, especially wrist, ankles, ligaments, cartilage, periosteum, uterus and skin. Now here there are so many structure I have named: tendon, ligament, cartilage, periosteum. Let us see what. You see, as a doctor you must know what is a tendon. See this picture. This is a joint. This blue colored structure are called, this blue color, they are actually cartilages. You see this cartilage. The portion which is in contact with another bone, they are covered with a slippery, slightly thick, soft structure is called cartilage. This is cartilage. Now ligament. This is a muscle. This muscle, at the end of the muscle there is a thick, tough structure which is attached to bone. It is called tendon. Muscles. When a muscle is attached to a bone, the end point is called tendon. When two bones are interconnected with soft tissue, this structure are actually ligaments. These are ligaments. You see, this is ligament is here. Ligament. This ligament. This is not. You cannot see this. What actually this ligament is here. Bone. The other point is also bone. That is clearly seen here. Bone to bone. This is ligament. So ligament, cartilage, tendon. Now periosteum. Periosteum means the covering part of the bone. This is a long bone. This is internal marrow of the bone. Now the topmost portion of the bone is called periosteum. So tendon, ligament, cartilage, periosteum. Everything is clear from the thing. Mind it. Tendon, one part is bone, another part is muscle. This thing, ligament, both portion is bone. Cartilage at the end point of the joint, cartilage. So ligament, cartilage and periosteum is the bony structure. Topmost structure of a bone is called periosteum. Topmost, the whole bone, long bone, the topmost cartilage, topmost portion is called periosteum. Pain or bruised, sore, aching. Patient toss in bed with restlessness. Sore, lame, bruised feeling over entire body as after a blow, fall or any type of mechanical injury, especially of bones, periosteum, tendons, ligaments. Blurred vision with aching in eyes after using means using the eyes for fine works or straining. Laying on parts become sore, lame, bruised. Even on bed, bacteria, pyrogen, hemomelis, naxpomic has got this symptom. Feeling of intense lassitude, weakness and despair. Generalities of Ruta. Continuation. Double dot means continuation. Ecchymosis resulting from blow over eyes with troubles in vision. This is ecchymosis on the right hand side. This is ecchymosis. Prolapse of rectum immediately on attempting to evacuate the bowel. Constant feeling of fullness in urinary bladder even following urination. Lameness after sprain. Heaviness as of a weight in forehead or hanging to feet or lower extremities. Paralytic rigidity with distortions. Formation of deposits or nodes on the periosteum. This is the formation of on the periosteum. Tendon about joints. Dissatisfied with himself and others. Disposed to weep. Suspicious. Imagine that they are being deceived. Fretful. Always quarrel and contradict. This is the mental symptom of Ruta. General modality of Ruta. Better. Lying on back, warmth, motion, rubbing, scratching. Worse. Overexertion, sprains, eye strain, cold air, damp, wet wind, lying, sitting, stooping during menses, uncooked and indigestible foods, ascending and descending steps. Steps means actually stairs. Particulars of Ruta. Head symptoms of Ruta. Aches, that is headaches, as if a nail driven into head, stitches worse from reading. Eye symptom of Ruta. Red, hot, painful from reading, fine prints showing, vision dim, lacrimation, itching of inner canthi. Inner canthi is the portion, the eye has got two ends. The ends which adjacent to nose is called inner canthi. Asthenopia, amblyopia. Amblyopia is lazy eye. Asthenopia is actually the nerve, the optic nerve, due to weakness of optic nerve, disturb in vision. Amblyopia is the lazy eye or also weak vision. Spasms in lower eyelid, lacrimation, seizing spasms. Nose symptoms of Ruta. Pressive aching at the root of the nose with epistaxis. Mouth symptoms of Ruta. Cramp in tongue, causing difficulty in speech, woody taste in mouth. Stomach symptoms, sudden nausea during eating, vomiting of ingested foods, burning, gnawing pain, violent thirst for ice cold water, tension in stomach, better from drinking milk. Abdomen symptoms of Ruta. Urging for stool, but only rectum prolapses, prolapse of rectum on stooping after delivery during hard or soft stool. Feces often escape when stooping. Stricture of rectum. Rectum, this is a picture of rectum, this is anal canal. Now, stricture of rectum means sometimes this due to infection or due to inflammation, there are growth or thickness inside the wall, so that the width of the rectum diminishes like this. Note this. There is some internal growth of muscles, not muscles actually, these are inflammatory swelling, then formation of fibrous tissue, leading to constriction of the channel. The dimension of the diameter of the channel is minimized. This is called stricture. Cancer of lower bowel, painful swelling of spleen, that is not shown in the picture. Urinary symptom of Ruta. Constant pressure on bladder as if it is full or moving up and down. Constant urging, can hardly retain urine. If forcibly retained, urine cannot be passed afterwards. Severe pain follows. Female organ symptoms of Ruta. Corrosive leukorrhea after irregular or suppressed menses. Respiratory symptoms of Ruta. Short breath, chest feel tight, weak feeling in chest after thick yellow sputum, painful spot on sternum, bad effects of mechanical injury to chest. Neck and back symptoms of Ruta. Weak bruised feeling in small of back. Small of back is this portion. Lumbar region is called small of back or simply back area. Hips and lower limbs in the AM, that is from night till 12 noon. This is called AM part, and after 12 noon to night 12 is called PM. Coldness in spine downwards. Backache, better from pressure lying on back. Extremity symptom Ruta. Thigh feels broken, worse when stretching the legs. Pain as if deep in long bones. Must walk about to get relief. Contraction of fingers, feet and toes. Hamstring feels shortened. This is the hamstring. There are muscles here. The muscles here behind the thigh are called hamstrings. Cracking in joint, worse walking in open air. Sciatica, worse lying down at night, better in daytime. Sciatica nerve runs from the hip area up to heel. This is the sciatica nerve, the longest nerve of the body. Better in daytime. Legs give out so that multiple attempts required to rise from chair. Knee gives way while ascending or descending stairs. There is knee trouble, ankles also swollen. Skin troubles at Ruta, easily chapped from riding, walking. In children too. Chapped means actually roughness or rather some rawness, redness of skin due to friction like this. This is called chapped, chaffing of skin. Sleep symptoms of Ruta: vivid, confused dreams, frequent yawning, stretching and extending hands. Wakes up frequently. Fever from symptom Ruta, glowing heat on face, skin, frequent attacks of quick flashes of heat. Complementary calcarea phos. Related arnica, phytolacca, symphytum, ranunculus scleratus. Few signs symptoms of Ruta that none should forget. This 1, 2, 3, 4, 5, 6. Everyone must remember it for Ruta. Sore and lame, bruised feeling over entire body after fall, mechanical injury. Sprains, dislocation or fracture, especially of wrist, ankle, knees. Constant feeling of fullness, urinary bladder, even just after urination. Flat warts on palms, hands with sore, lame, and bruised feeling. Prolapse of rectum immediately on trying to evacuate bowel. Patient restless, toss and turn in bed to get relief. This symptom also are in Rastaks. With this, the video ends. Thanks for listening and viewing. If you got anything to say, please write down in the comment section. I would certainly attend it.